they're trying to get a steering committee together for the library, new library. And they've got somebody from the county and the CDC, Community Foundation. They're looking for somebody from the city. And if you're interested in being part of that steering committee, see where the direction they're going, what they're looking at. Working together.
So I think that'll be good.
I'd get back
We're
to
going to send
her.
out an email today, and once he gets the investigative packet, then we'll get started. But, yeah, so that'll be good. Be a good experience for both of us, hopefully.
Yeah.
We'll see.
And with people from the
Good, how are
foundation
you?
and
Do you have a match to go with every outfit?
Yes, just
guide.
about.
I'm impressed.
So it doesn't get out of control. They know
See a man with dog, a man
the
with
hoops to
wear
jump
stripes
through
going up and down.
They're looking at.
Dress going the other way. Man doesn't know.
We wouldn't know.
I think new,
She knows.
but Tillery was
They did.
one of them people
Good.
there north of the college. And I don't know if that's still
away
not.
from you.
Mike Cal out of Kearney.
I can't believe that. There's probably many people.
But, you know, if they don't have any
A lot of prayer.
plans for funding yet,
You know,
Yeah.
I
kind of
think,
feel like you're dodging a bullet. Really.
yeah, I don't know what
Schools have
it
been
said.
relatively free of it too. I know I had like 13 dare kids who had
The city will probably be involved somewhat.
fifth graders. They only not
Because right now,
they had it.
we support library 60%, 40%. And I don't know how that will go,
Yeah.
if they
None of
will,
them had it. They're all back in school.
how that's gonna work.
I only had
But I think there's somebody from the county there.
three missing, I think, the other day. None of
There's
that
a lot
was due to
of
COVID.
questions of how's this gonna work.
That's better than having 13 for 2 weeks in a row.
Boy, you got that right. Yeah, I don't see a problem with it. Real pleased that they've been able once a week to keep open.
Oh,
and-
thank you.
I'm guessing maybe once a month. I don't know.
Some more, yeah, I'm good.
Something, they just hit me up this morning.
Nobody else has a problem. I don't care.
Ordinance in there, so.
Yeah.
I don't usually bite, so if you want to slide it.
I've heard stories.
Yeah.
If there's some more coming, we can social distance back here too, so. We don't charge extra. We might keep an eye on those two young ones over here. I think you might be able to
Be on my back.
That's fine.
get the stomach feeling there.
Yep.
Like to call this meeting to order. We just said Dorothy Anderson's, our last piece of the puzzle will become later, right on time. Roll call.
First of all, state law requires this body to announce at this time that a copy of the current Open Meetings Act is at the back of the room where it's accessible to the public. Mayor Young,
Here.
Dorothy Anderson,
Here.
Scott Erzman. Here. Dennis DeMue,
Here.
Ben Johnson.
Here.
Thank you.
Okay. We are here tonight to talk about the possibility of implementing a mask mandate for Holdrege, Nebraska. We have called our special meeting of our health board. Health board consists of police chief, Dennis DeMue, a council president, newly elected council president last night, Ben Johnson, Dr. Erzman on the medical staff, and nurse Dorothy Anderson, and the mayor. Not so honorable Doug, but that's the way it is. We have our city clerk here, and we also have our newly appointed city attorney, so keeps us legal. So, You know, I haven't had too many of these health board meetings. We had one in October, and now we're having one in December. And I don't ever remember, I don't think Dr. Erzman, I don't think anybody else has remembered that we've ever had to have a health board meeting. I think we need to replace the mayor. But this is serious stuff that we're looking at tonight, and I'm glad to have some people here in the audience who know a lot more about this virus, coronavirus 19, than I do. So I think if it's okay with Health Board, we'll open up to public comments. Whoever wants to start about a public comment, I'm going to recommend Dr. Burney. He's been practicing the other night. If he wants to get the ball rolling.
I will pass that baton to Dr. Erzman, if he would like.
We'll get her started.
I will. As Dr. Burney shared at the City Council meeting Tuesday night, the healthcare providers, Holdridge, Nebraska, are recommending that the City of Holdridge enact a temporary mask ordinance. This is going to be kind of to reiterate some of Dr. Burney's points, and then I'd like to expand and add to that as well. We want businesses to stay open and our kids to stay in school. Ultimately, we as the community want to stay in control of our livelihood. We know that masks will not kill or prevent COVID-19, but they do slow the spread and help people resume a more normal life. There have been many other public health measures used in other regions, as in asking people to stay home, limiting business hours, or complete shutdown. We want to avoid these measures by using a method that carries almost no inherent economic toil and can be easily implemented. We feel that time is of the essence because of the situation statewide that all of you are aware of. With the nature of this virus, the impact is delayed 3 to 4 weeks. We understand the economic toll that COVID-19 has taken on the community and will continue to take unless we change what we're doing. We probably do not need to spend much time discussing if coronavirus is dangerous, or whether we have a high prevalence in the community, or if wearing masks decreases the spread of the virus. These facts are very easy to agree on. The real question for tonight is whether we, in our current situation, warrant a mask ordinance, and if we feel that is legally, ethically, morally appropriate at this time. Let me provide some framework. Mask effectiveness. Wearing face masks has been shown repeatedly to reduce the transmission. Multiple studies have validated masks can reduce the spread of the virus as much as 80%. We've seen this work this year within our school system, within our hospital, our clinics, and within large businesses in our community. Our schools have been open this entire semester, and the kids have been able to participate in sports, in large thanks to masking. We've also seen the effects of this on a regional level, such as when Kansas placed a statewide mandate, but allowed individual counties to opt out. Norton declined the mask ordinance, and since then have had a serious outbreak in their prison, with almost 700 inmates positive and almost 100 staff. They also had a nursing home there where every resident became positive, and 1/3 of those people lost their lives. Our nursing homes have done a phenomenal job during this pandemic, but the actual best way to protect these vulnerable populations is to decrease the virus spread in this community. It is the workers who live in our community who bring the virus into these facilities accidentally. We cannot simply continue to ask people to stay home when they have symptoms as a public health measure, because you become infectious 1 to 2 days prior to the start of your symptoms. Even with the best of intentions, without masks in place, this virus continues to spread. There will always be a percentage of people with the virus who develop critical illness. Unfortunately, across our state, we're very short on intensive care unit beds. We know that the best way to care for patients who are critically ill from COVID-19 is with good quality intensive care. There is no one-size-fits-all management. This requires nursing staff, respiratory therapists, and physicians to have the time and ability to provide intensive, personalized care. We've seen in other areas such as New York, North Dakota, and Italy that the risk of death from COVID climbs significantly when the system is overwhelmed. You also suffer loss of life from other causes when those intensive beds are full. Motor vehicle accidents, strokes, advanced cancer surgeries, open heart surgeries, all of these require the same personalized, time-intensive care that cannot be delivered if we stretch our workers too thin. Influenza season is just around the corner as well, and will play a part. As far as civil liberties go, we do not want masks to become the new normal. But our student athletes illustrated it best when they recognized early on that by wearing masks consistently, they had more freedoms and were able to, in many ways, return to normal life. If we can follow the example set by our youth, we can continue to have the freedom within our community that would not only help economic stimulation, but also protect our citizens, especially those at higher risk for complication, which includes people with multiple medical problems, people that are immunocompromised, and the elderly in general. This security is what our community needs to keep businesses open. Our goal is not to completely eradicate the virus in this community. I wish we could, but that would come with too many secondary consequences. We need this temporary ordinance to help flatten the curve of this current surge so that our community can receive the care that they deserve. Please keep in mind that time is of the essence, as again it takes 3 to 4 weeks to see the impact of changes given the nature of this virus. On TV this morning they had mentioned that some of the physicians that are in the know think that the peak of the virus across the nation will be in January and February. If you enact a temporary mask ordinance, you have the opportunity to save life and to do the right thing for yourself, for your loved ones, and for your community. Thank you.
Thank you. Thanks for the time putting that together, Doctor.
Yeah, it was a combination of many efforts, so I can't take credit for it.
Well, I think many of us have been following these mask mandates, been following the coronavirus from the governor's conference calls to the newspapers throughout the state. We're not the first one, we're not going to be the last one to look at these mask mandates. Like Dr. Erzman said, we'd like to see this curve flatten out. I just heard this afternoon I had a first cousin succumb to that. He had pneumonia and coronavirus. I see it in my neighborhood. I go down the street right here. I don't want to have to go far my block. It's here. So that's what we're here to talk about tonight, looking at this. And that's why we have the medical professional looking at it, advising us on their opinion. Not only the opinion, but the facts. That's what we want to go by. So, Dorothy, you want to add anything else to that? You're in the nursing home business.
Well, from my perspective, you know, I think Dr. Erzman did an excellent job of all the facts and figures. And we have seen, I work for a nursing home, and I also do a TheraCare hospice, and we're mandated to wear masks. And not only to protect ourselves, but to protect all of the people that we care for. And it's a small part of what we can do to make a big difference. I think it's the only way we should go.
And what I hear, it's more about protecting others, not infecting. I could be asymptomatic. I could be a carrier. I could be infecting people without showing any symptoms. And that's not good. I don't want to affect somebody and not knowing it. This is a novel coronavirus. We don't know everything about it. Nobody knows how it's going to act on me, on anybody. It's something that's, my daughter-in-law says, treat it like it's a pandemic. Well, it is. It's a plague. And that's what we want to try to stop. I will open up discussion to the public, the input. Who wants to start? Canify with Two Rivers.
Thank you. Do you mind if I sit?
Be my guest.
Thank you. Good evening. Tana Fye. I'm an attorney here in Holdridge, and I'm legal counsel for Two Rivers Public Health Department. And I want to speak this evening in favor of a mask ordinance being adopted by the City of Holdridge and being recommended by you, the Board of Health, to the City Council for the special meeting that is coming up on Monday. I'm not going to talk about the science. That's not anything that I have any particular knowledge about, other than just the bits and pieces that I hear from the folks that I work with at Two Rivers. What I just want to touch on briefly tonight is essentially the legalities, as I see it, with respect to mask mandates at this point in time. So bear with me for those of you who maybe heard me speak briefly on Tuesday night. I know not everybody who's on the Board of Health was here, so I want to just touch on some of those pieces again. Two Rivers Public Health Department has regulations in place to enact directed health measures. Those have been in place since 2006. But when the pandemic really got going back in March, the Department of Health and Human Services for the state issued an opinion that health department directed health measures would not be enforceable within municipal limits without memorandums of understanding between the health department and those municipalities. Some cities, like Holdridge, went ahead and enacted memorandums of understanding. However, many did not. And so what we have at this point in time then is a patchwork, where if the Public Health Department issues a directed health measure, it's not universally enforceable within the entirety of the district. At least partially as a result of that, the governor and the chief medical officer for the state of Nebraska essentially said, we're not going to go with local directed health measures. All of the directed health measures at this point are going to come from the state. That essentially leaves the Public Health Department with our hands tied in terms of being able to enact a directed health measure, because the chief medical officer for the state has to sign off on all of the directed health measures that would come out of a public health department. So at this point in time, the Public Health Department for the district, for Two Rivers, isn't able to enact a mask mandate. They've done essentially what's their best option, which is a resolution recommending and supporting local action from municipalities. And so that's partially why I'm here tonight. The health director, Jeremy Eshelman, is here tonight. I'm guessing you may hear from him in a few minutes as well. So the state statutes that deal with cities of basically all sizes across the state already have in place creation of a Board of Health, such as the one that is meeting tonight, and give you the power to enact rules and regulations that have the force and effect of law to safeguard the health of the people in the city and to provide fines and punishment for the violation of those rules and regulations. So you, in and of your, as a board, just as yourself, could enact rules and regulations. That's a route that some cities in our state have chosen to take. Others instead have chosen to take the approach of, we're going to make recommendations to the city council. City council can then choose to enact a mask mandate or not. And that's a perfectly acceptable approach as well. The city has in its local ordinances provision for this kind of situation. So Holdridge, Nebraska Ordinance 1-708 provides for emergency ordinances. So that's your power for the city to enact something like this on an emergency basis that could last for a short period of time. The local city ordinances also create this Board of Health, and your duties are to, just as the state statute says, enact rules and regulations that have the full force and effect of law to safeguard the health of residents of the municipality. And in addition to that, Holdridge also has an additional ordinance that says that you have the duty to work closely with the county's health board in protecting the health and welfare of the residents of the municipality. And that's Ordinance 4-104. Feel free to take a look at that. Check my work if you wish to. The county powers were delegated essentially to Two Rivers Public Health Department through interlocal agreements and county resolution. So as I view it, essentially this body that you all are serving on tonight has the duty to work closely with Two Rivers Public Health Department to enact whatever measures would safeguard the health and welfare of the citizens of Holdridge. As I mentioned, Two Rivers enacted a resolution supporting a mask mandate. And so my hope is that you all will follow the duties that I think are spelled out very clearly in state statute and in local city ordinance, and are supported by all of the medical information that's available at this point in time, and that Dr. Erzman just testified to. I had provided to your city attorney examples of some other city ordinances that were enacted in other places in the state. They appear to be all fairly similar in terms of the scope, right? We're requiring masks indoors when people are congregating. There are exceptions laid out for things like being alone in your own car, being in your own home with just your immediate family, those sorts of things. They also provide for particular penalties. And I know this is something that really concerns a lot of people. Are we going to start having people calling in their neighbors, calling in their friends, calling in their family members if they see people not wearing masks? And this, just like any other ordinance, just like any other law that is passed that has a civil or criminal penalty, there's such a thing as prosecutorial discretion. What that means is that local law enforcement officers have the ability to give warnings instead of writing tickets. Your city attorney will have the ability to choose to not charge or prosecute a particular case of not wearing a mask if she chose to, and instead issue a warning. So that's something that's always available whenever you have this kind of an ordinance that would require a penalty for non-compliance. But I think that the literature that's available is abundantly clear that just simply having an ordinance increases compliance with wearing masks, whether it's ever enforced or not. And I can also tell you that there are already some efforts underway to try to get the word out, increase compliance through things like signage and just general goodwill, working closely with businesses, working closely with entities like PCDC and the Chamber of Commerce to get this information out so that we don't have a situation where people are not in compliance right off the bat. So with that, I'll just conclude my comments. I'm happy to take questions, and I'll stick around for a while this evening if you have any additional questions or need any additional information that I can provide. So thank you.
Thank you, Mrs. Five. Who would like to be the next? We want to be, if you have something to say, we want it to be heard.
Jeremy Eshelman, Health Director at Two Rivers, and it's hard to follow Dr. Erzman. Thank you for your comments on the medical staff here. We have great medical staff here in Holdridge. So, and thank you, Tana, for talking through the legalities of that. So, I've said multiple times, and we've presented in mass media, the science is settled on masks, and I think it's really true. There's been over 45 studies across the United States on the effectiveness of masks. You've probably heard sayings like, when you wear a mask, you know, my mask protects you, your mask protects me. That's very true. There's also some benefit personally. There's some science coming out showing around viral dose theory, showing how it really is effective for you personally too. I'm not going to go into that. I think that's really a foregone conclusion. I really would like to talk about a little bit of the ethics behind this. And we look at public health laws. There's many laws on the books, and as Chief Herman knows, seatbelt laws. There's laws regarding drinking and driving. there's smoking laws about prohibiting smoking indoors. And so if you look at those notions, those are usually policy developments that take years and decades. I use the example of seatbelts quite a bit. When I was a kid, I rode the back of a truck quite a bit. Well, now you would get a ticket, I'm assuming, if you drove down Main Street in Holdridge riding back to the pickup with some kids. So that being said, we don't have a luxury with this virus. This virus does not care if Holdridge passes a mandate now or in January. We're going to continue to see it do what it does, which is spread. And you know, while a mask mandate is by no means the only tool, what it does is signals to a community, and we've seen this time and time again, that a community is serious about this, and it's really the apex of sort that it creates a culture of health and wellness. And so people take it seriously when they're sick, they stay home more. You're never going to get 100% compliance with any sort of regulation of sort like that, but what it does is it shifts the curve, the compliance curve that is, as far as who is wearing a mask, what control, what spread there is in a community. So. And the last thing just to mention, just to be brief, is the risk. There's significant risk that still exists. We're putting out some data this week, might have came out today, I believe, a weekly risk file we put out. It shows that hospitalizations are down. We're showing some decreased case counts. Don't be lulled into thinking we're okay. Quite in fact, we're not. A couple things that lead to those data metrics. One, there's significantly less testing in our district last week with the Thanksgiving holiday. There was there's one major event, Kearney. There's Thanksgiving on Friday, Black Friday. Of course, a lot of other things going on, but nonetheless, we are far, far from out of the woods. And I would also agree with Dr. Erzman mentioned, having a possible climax sometime in January. That's quite possible. We're hopeful there'll be a vaccine, but there's a lot of hurdles that still have to be crossed before that happens. And a vaccine is only one component. You have to have people that actually take the vaccine, and it has to be effective. And the science coming out right now shows that the vaccines that are coming down the pike are highly effective, but yet those are some challenges for us. And there's been a model that's been portrayed by some of the folks down at UNMC, some experts in infectious disease, and shows like a Swiss cheese model that no public health intervention singularly is perfect. Everyone has a weakness per se, and a mask is just one of those interventions. So you think about the effectiveness of quarantine, effectiveness of people when they're sick staying home, getting tested. Those are just some other strategies. So a mask is just one strategy, but it is highly effective. And there's some great evidence, through the Tri-Cities. Kearney, Grand Island, Hastings have went this route beyond what Lincoln, Omaha did. So I think it's a great chance for Holdridge really to stand up and make a point of this, and really appreciate the support.
What's the three C's that we're looking for, not only in the mask?
So we're looking at confined spaces, crowded places, and I think you're putting me on a spot here.
Social distancing.
Right. Close contact.
Crowds.
Yeah, close contact. So there again, if we're having this meeting outside today, we're all spaced out effectively, it's an entirely different dynamic. The airflow, things of that nature. So the challenges in Nebraska, we can't always do things like that this time of year, specifically as we're going into the cold time of year. So there's a lot more risk with respiratory diseases in general. So, and we have to look no further than our schools. Our children really have led the way in this regard for us. We've seen how this has been highly effective in schools, which is, by the way, when we looked at our pandemic plans as a public health department, schools were never supposed to be in session during a pandemic. And yet we saw the initial research and we were fully behind in-person school. Anyone that's had children during March, when school was virtual, can acknowledge, like, that was terrible. At least for me, that was terrible. So I talked to another health director today. I was telling Pam a little bit ago that she's in quarantine. She has 2 kids. She has one child that was positive that created the quarantine issue. 2 other kids, within 15 minutes, one child's having a Zoom problem, another one's having a different problem. So just the challenges there. But nonetheless, we've seen it time and time again. That's why our schools, we fully support Two Rivers schools being in person instruction. It's just been effective. We've seen masks be effective in that way, and I really want to continue that. So, anyway, thank you.
Thank you. And as the city and the council, we haven't put our head in the sand. A month ago, on the 3rd of November, we did pass a resolution 2020-11 recommended the mask, encouraging social distancing and everything. So And that seemed to help a little, what I've seen out in the community, but it hasn't flattened the curve enough yet. So that's why we're still looking at the mask mandate. Yes?
I just have one question that's not directly related to COVID, since you brought up the point of ethics. I'll be very clear, I'm not an anti-masker. We live in a great country. We have individual liberty, and if somebody wants to choose to wear a mask, that's fine. I have a question for the medical professionals or practitioners in the room. In your practice, is it ever medically ethical to mandate a patient to take a medication, to mandate them to seek a certain treatment, or to mandate that they choose to do something for medical purposes? Or is it up to that individual's personal choice?
I'll address it in a little bit of a circuitous way. No, it's not medically warranted in those situations when there's risks with it. I find risks to have basically, or masks to have basically no risks associated with it. And so you have to balance risks and benefits with anything we do, and that's the conversation I have every day with my patients. There are basically no risks that I can think of by asking someone to put a mask on. And as a society, we do mandate lots of things that people may not ethically agree with. You have to wear shoes when you go into a business. You might not like it. It might not be comfortable, but we ask you to put shoes on if you're going into a public place. And I think it's very similar with a mask. Is it comfortable? No, it's not. It's not something we love to do, but it's something for a short period of time for the better good of the society that I do think it's right. And from an ethical standpoint, the risks and benefits of this, the benefits far outweigh the risks, and that's a piece of ethics too, is harm and benefits. And so I do think in this case, it would be warranted, and it is
Yes,
ethical.
but initially, the short answer of that is no. It's not ethical to mandate that you have a patient take a certain medication or seek a certain treatment.
In the back there, in the corner?
Question for Dr. Barney. If you recommend that someone take heart medication, who is that heart medication going to benefit? The person that takes it?
Yes.
If you recommend someone wears a mask, who is that mask going to benefit?
The patient and
And?
others.
And others? Thank you.
So
If I-
what about with the
also
flu?
may.
When we're talking about infectious diseases, there are situations where medical professionals do force essentially a patient into a particular course of conduct. If you've got tuberculosis, there are laws on the books that say that you have to follow through with your tuberculosis treatment. There are people who go and physically watch you take that medication to ensure compliance. There are situations where they enforce isolation and quarantine. For example, if somebody had measles. So there are situations where medical providers are in a situation where they essentially have to force a patient to undergo a particular.
And what
type
are
of
the
treatment.
mortality rates for those particular infectious diseases?
As I mentioned earlier, I am not a medical professional, so my job here tonight is to not talk about mortality rates, is to not talk about the medical piece of it. Your question was about ethics. My answer is about ethics, that there are particular situations where it's completely ethical for medical providers to engage in a forced course of treatment.
So, I was in training when the Ebola virus came through, and we had a lot of those patients at UMC. And, you know, from an infectious standpoint and mortality standpoint, Ebola in certain populations would have a similar mortality rate. Measles would actually have less of a mortality rate compared to this virus in certain populations. And in particular with the Ebola virus, nobody was allowed to be in contact with that patient. Unfortunately, you know, this virus has spread to a pandemic level where we can't control it as easily as we did with Ebola by it just not spreading as fast. This one spreads much faster, is much more infectious. And so with this virus, the way to contain it now is not necessarily not letting someone into the room with that patient, but assuming that we all potentially could infect others, and masks help reduce that spread now that it's even further spread than those type of viruses.
And so to jump on that a little bit, mortality rate isn't as big a deal, I don't think, as the morbidity of this. I mean, we're having patients in the hospital for long periods of time, and that's backing things up. So we're running into situations where we you know, have no place to put a trauma patient, we have no place to put a heart attack patient because these patients take so long to take care of and get over their illness. And so it's not just that the deadliness of it, it's how much morbidity there is associated with it.
And attached to that, not just the mortality, but the long-term consequences of this, it's way more than the one person that might die if they get it. We are seeing long-term issues with these patients that we don't have great explanations for right now, why they have chronic shortness of breath, chronic fatigue, some of these things. And so it goes beyond just they left the hospital and things are fine. As a medical community, we're worried about the long-term damage of this that we don't understand right now.
Is there anybody here from the education system, school system? I know the school system requires masks for everybody that goes in there.
Yeah, but that's led by the public health department of Holdridge.
Yeah. And the school is doing very well with the control of the COVID-19.
I'll say at my daughter's school in
Ron?
Raleigh, she does not have to wear a mask and they have not had any outbreaks.
I'm just a question to the medical community here. Could we just, in general terms, I know there's some confidentiality procedures that you wouldn't want to violate, but could you just describe what our current situation is with the medical community, the facilities that we have here?
Are you speaking here specifically?
Yes, in Holdridge.
I was on call for the ER last night, and I admitted a patient to our SCU, and they said, well, they're only taking out because we only have one of those beds left. So that's been a running theme for the last several months.
I can attest to it on almost every single shift that I've had in the last couple of months, in the fact that we're not just dealing with problems with people coming in with COVID-19. When you're sitting in their ER as a medical provider and you have somebody's family member come in and they're having a heart attack or they're having a stroke, and the best I can do is what I have available and the resources that I'm limited to in our ER, it is so unfortunate to go and tell a family member that I am sorry, but your significant other is having a heart attack, your father's having a heart attack, your brother just came in with a trauma, or your dad is sitting in that room with a stroke, and I can't get him anywhere. I can't get him anywhere. I got declined by 6 hospitals on one shift, and they told me that they would put me on a waiting list for an ICU bed for that patient's
And is it
status.
because they are understaffed at the other
They are
places?
not understaffed at these facilities. There are no ICU beds available to send these people to. I don't have transfer availability. I don't have ICU bed availability. And so I sat on a stroke for 6 hours. How would you feel if that was your brother or your father or your son? And all I can do is the limited resources I have.
And you're saying that's because the beds are now occupied?
The beds are now occupied by so many COVID-19 patients, and those ICU nurses are so busy taking care of them because that's what's coming in. And so everything else that doesn't stop, critical illness doesn't stop, strokes don't stop, heart attacks don't stop, traumas don't stop. And so then we're sitting in our ER taking care of patients that we should not be taking care of. They should be shipped out of our facilities within 30 minutes. Our trauma times are 120 minutes. Those patients should never be sitting in our facilities as long as they're sitting in these last couple of months. It is hard. It's hard. You talk about ethics, it's hard.
Thank you.
I guess, is it okay to, I just want to jump on that as well. You know, our goal, you know, none of this came without trepidation on our part as healthcare providers, as hospital workers, as nurses, as whoever. I think our goal is to protect people and prevent disease. You know, we took an oath to do so. And that's all we're trying to do is prevent our ICU beds, our hospital beds, our ER bays from being full from something that we may have an impact on, a slight impact on, by just asking people to do something it's a very simple step to just help minimize spread. We're not going to cure it. but minimizing the spread to keep those hospital beds, ICU beds, ER bays open to continue to give good care, appropriate care, not rationed care like Katie speaks of because of a lack of resources. As a whole, they can be minimized or even prevented if we can just make a small change. We're not here to try and make people angry or get into an argument about. We just want to do a simple thing to help change this curve a little bit. It's the same curve we talked about back in, January, February, March, when the entire world shut down for something that really wasn't even here yet. It kind of started on the coast and works its way in, and we're, why are the universities shutting down? Why did they, my sons, why are they stopping my baseball season? Why are these things going on? We needed to flatten that curve, and we saw in New York, not that far away, what happens when we don't have those resources, we don't have those beds. And it's very hard on us healthcare providers being in the emergency room, and not everything that comes through is COVID. We get that. But if we can minimize the COVID that comes through so that we can take care of all these things that didn't go away just because COVID showed up. We still have influenza to deal with and all these other health problems that Katie and the others have mentioned. They don't go away. And so I think enacting something such as a mask mandate it's not an easy thing, I get it, but it doesn't come without trepidation. We're not wanting to get into a match with anyone. We just really want to help the system, help the ICU beds. When 3 weeks ago, Dr. Stecker had to call 9 different hospitals to try and get one person out of there, that takes a ton of time. So what happens during that time? Well, you're not taking care of your grandma that's in here with pneumonia. You're not taking care of this heart attack that's in there as quickly as we need to because the whole system is stressed. So I guess that's just what I wanted to jump on and add. So thank you for listening.
Thank you. And we know going in that we're not going to make everybody happy. Everybody's not going to be wearing masks. We know that. We are encouraging that. We're trying to flatten that curve. We're trying to help their medical field, the professions. They just put a $13 million expansion on, a beautiful hospital, great facility. We got to help them somehow. If somebody has some other solution other than a mask mandate, we're open. We need to slow this stuff down somehow. Anybody else want to add something that we have not discussed yet?
I have another question.
One more question here.
Implement a mask mandate for hypothetically 4 weeks, however, whatever time frame that you put on it. And the numbers don't change in 4 weeks.
What are you gonna do?
There's no alteration to the numbers.
4 weeks is not enough. As
Okay,
I
8
mentioned
weeks.
before,
8 weeks.
you need to give it enough time knowing that there's 3 to 4 weeks
Okay,
to even
8
catch
weeks.
up.
So after 8 weeks and the numbers haven't changed, are the mandates gonna stay in place?
We don't know the answer to that.
Then why are you gonna put a mandate on when you don't have an end result? When you don't have a plan?
We'll certainly look, and we'll look, and the curve most likely will be flattening. I think that I have a list of the different cities that have done this already in Nebraska. Omaha, Lincoln, Grand Island, Norfolk, Columbus, Hastings, Beatrice, Kearney, Ralston, Gretna, La Vista, David City, Fairbury, Wahoo, York. Others that are pending. I don't think they would do it if there wasn't a good reason.
And
The
so
example that was given before too just doesn't hold water. Certainly we can't make our patients take their cardiac medications. It's a free country. But for them to not take their medicine does not affect somebody else. Does not have the potential of perhaps putting them in the ICU or causing their death or causing an infection in someone that's immunocompromised. You're affecting someone else by not wearing a mask. It's more than our selfish selves. It's caring about other people, caring about the good. That's what it comes down to.
Chief, then Jeremy, then back in the corner here.
Yeah, doctor's note is, or point is noted. Sometimes we have to think about other people. Prevention is sometimes hard to evaluate. You know, we can have, where would we be without prevention? I can't answer that. If nothing happens in 8 weeks and it didn't change much, how do we know it wouldn't have been worse? Don't know. So it's kind of hard to evaluate the prevention by people wearing masks and nothing changes in 8 weeks. Well, it might have been way worse if we didn't wear the mask. It might be double, but it stayed the same. I mean, so prevention is a hard thing to evaluate, but I appreciate the medical personnel being here. As the chief of police, I know myself and officers are quite concerned as to how we are going to deal with it, because it's going to fall a lot on us. Not that it's not going to fall on other people too. You know, as police officers, the number one thing I always think of is prevention. That's why we have the DARE program. That's why we have marked police units. So people see the police car and they stop at the stop sign. So prevention is the number one thing we want to do. And I hope people would know that we want to educate people. We want to then warn people before we would start citing people. We're not going to be heavy-handed. We have other things to do as police officers, and I did talk to some chiefs this morning. We had chief and sheriff's meeting over the South Central region, so I did talk to some of the chiefs that will remain unnamed, but one chief said they expect the businesses to kind of enforce that. When people come, they want them to say, and so things need to be advertised out on the doors, and if people come in, they need to step up and say, we would like you to wear a mask. Now, some of the businesses probably aren't going to appreciate that, but many of the places you go into now, people are wearing masks. I don't always do it, and I'm sorry. I get out, I'm halfway to the business, forgot my darn mask, and so I said, I'm just going in. Now I'll try to do better in the future, and I have tried that. But just the other day I had to go to the hospital. Same thing. Got out, went back, got my mask. So to me, it is a small price to pay to help prevent some things. It's not going to stop it. As Jeremy said, I was thinking the same analogy there about seat belts. I wish I could get people to wear seat belts. And if you mandate seat belts in states where you mandate it, it's a primary law, the use of seat belts go up overnight into the 90%. Whereas Nebraska is still way low because people feel that we're going to violate people's rights, or we're going to stop them for some reason, the color of their skin, or we don't like that individual, so we're going to stop them because of the seat belt. Well, there's a way to prevent that. Put on your dang seat belt, and it might save some people's lives. I think it's a small price to pay to be responsible to help other people as well as help yourself. You know, and I'm in the DARE, teach DARE every week in the schools, and kids comply with the mask, and they do pretty well. And we've had I don't know of many situations where kids have gotten COVID, whether we were in the high school, we're in the 5th grade class. I see the kids, they wear them, and they come in, they don't have them on. The teachers tell them mask. You know, they have it maybe down below their nose or something. They'll tell them mask, and they put it on. And so I think it has worked well in the schools.
That's what I hear. Jeremy?
Chief and I are on the same page. I should have went to law enforcement, I guess, as a career, but I'm thinking along the same line. You know, prevention is extremely difficult to measure, You know, it's to use the analogy of seatbelts, how many people are, how many lives are saved every day, it's really hard to measure. And that's the challenge we have in public health when it comes to measuring prevention. Well, so what we rely upon is research, the research of what's effectiveness out there. And the closest thing, I think Dr. Erzman mentioned already, there's a study in Kansas that showed counties that they had an option to opt in or opt out, different counties. And so a really great study showing that counties that chose to opt out of a mask mandate had significantly higher disease, almost 100% more, quite frankly, than a lot of other counties that chose to actually have a mask mandate. And I've heard from multiple businesses, of course we receive a lot of complaints to the health department in general, but a lot of business owners, specifically in the Kearney area, when they went forward with that, they said they were relieved because it then took the pressure off of them. Because customers constantly are thinking, okay, do I shop here, do I shop there? And it standardized it in a lot of ways. And so right now what we have in a lot of ways are businesses that are early adopters of different things. And so they choose to require masks, some don't. Then what does it equal the playing field? And what better time than now, honestly, for holiday shopping and to do that. But,
Have you heard that from Holdridge businesses in particular?
you know, the comments I have, I don't want to allude to, we cover 7 counties, so I don't want to talk about specifically one community.
Yeah.
So you don't know?
I don't want to comment to that.
You're back in the corner?
Yeah, so, I mean, in this, I am not a lawyer, and so I was just gonna ask kind of the Washington, precedent-wise. I know that a lot of people talk about this being a civil liberty thing, and, did a little bit of research on my own, which can get people in trouble. So, that's why I'm referring to you guys, but in 1905, there was a case, Jacobson versus Massachusetts, which basically pulls out the legality of this and how in a public health emergency, our liberties can be, I won't say taken away, but just adjusted so that our liberties as an American aren't, how do I say, just given to us without taking away. So basically in a public health situation, a mask mandate can be enacted. At that time it was a smallpox vaccine to help a small outbreak, but I was just going to bring it up to you guys and see if you had any other information on precedent with that.
Supreme Court Justice Neil Gorsuch just issued his ruling on the newest case that came before the Supreme Court in New York regarding people going to church and having certain limitations with going to church and their ordinances within their city. And to quote him, civil liberties do not disappear in a pandemic, nor should they.
So in this.
Yes, I'm just quoting the most recent, I
Yep.
think it
And
came
so-
out in the last couple weeks.
Yeah, and so that's why I was bringing out with them is just that this was a precedent set back then and is protected by the Constitution as I understand it.
So it's pretty well established constitutional law that there are different levels of scrutiny for different kinds of law, okay? So they look at what types of restrictions are being placed on people, and that determines how much those particular laws are scrutinized. The case that you're referencing involves restrictions on freedom of religion, which are scrutinized at the very highest level. This wouldn't be that type of scrutiny because this isn't a restriction on freedom of religion. And so what you're talking about is pretty firmly established public health law, that we look at this particular circumstances of the time, we look at the particular circumstances of what that particular law says to determine what is being restricted. So I think, as I made clear in my earlier comments, state statute clearly authorizes the city to take this kind of an action, where it would be across the board, not singling out churches, not singling out particular people, not singling out particular businesses or types of entities or that sort of thing, where this is just an across the board, you wear a mask when you're inside, with, again, particular exceptions. That would be scrutinized at a fairly low standard, and so my take would be that this would be very likely to be upheld if it were appealed. I'll let your legal counsel advise you particularly and perhaps in private on what she thinks, but that's my view based off of what I know about public health law and constitutional law.
Yeah, and I think just on kind of a general level, I would absolutely agree with Tana. I think that an ordinance like this is going to be scrutinized at a pretty low level, given the fact that we're not applying it just to certain groups of people or certain activities. It's going to, if there's an ordinance passed, it would be an across-the-board ordinance that would apply to all people or all indoor settings. And so I think given that and the fact that wearing a mask really is a pretty minor restriction, I don't anticipate any legal issues with an ordinance. We've seen, obviously, Lincoln and Omaha have had theirs in place for a number of months at this point, and really haven't seen any legal challenges to that. So.
Well, thank everybody for their input. Talked about the Omaha ordinance. I think they've had their mask mandate in the books since August this year, and they've wrote, what I understand in the paper the other day, they wrote two citations. But they are, like the chief says, trying to get people to comply, trying to get them voluntarily to go along with it. Scientifically, medically, the masks have highly recommended, CDC, medical field. Our hospitals are overwhelmed. And we need to do what we can. What's morally right, not so much for me, but protecting my neighbors, people that I'm around with. That's more of what that mask is about. Not so much me, but protecting others. And that's why we're here tonight. So. Okay, Health Board. What's your recommendations that we go from here? I do have a emergency or a special session scheduled for Monday, the 7th, for the council to look at our recommendation from the Health Board.
And Doug, just a question, like if we did issue this mandate, then along that line, then how would that mandate be enforced?
How long will it be?
How would that mandate be enforced?
Well, hopefully voluntarily. We encourage people to do it. Other communities look at a $25 fine, and the chief is looking at what other chiefs do in other areas, try to get people to comply, not so much. I can envision, we got people in the community, they're gonna dial 911. So-and-so's not wearing a mask. So-and-so's got his mask below his nose. They could be inundated with phone calls. They handle that.
So that will be to be determined how the mandate will be enforced? Or
That would be, it'll be spelled out in the ordinance if the council chooses to adopt one. So just, I guess, to kind of go through the process so everybody's clear on what we would do tonight. Tonight, the Mental Health Board just needs to decide whether or not they want to recommend a mask mandate to the council. And then that recommendation will go before the council on Monday evening. If the board decides to recommend a mask mandate, then an ordinance would be drafted in advance of Monday's meeting so that the council has that to review, and then ultimately the council would choose whether or not to adopt that mandate.
I see.
That the ordinance would have spelled out in it the penalties for violation. And I think I provided you guys, or Dane provided you with copies of Kearney and Hastings.
Yeah.
Both of those ordinances, and really about every city that I looked at, have kind of a twofold enforcement mechanism. One is against individuals, and typically it's a $25 fine, it's a misdemeanor charge. We kind of already talked about, there's obviously the option of giving warnings and that sort of thing. The other option is to potentially enforce against businesses. And again, I think this would be a last resort. Some of you may have seen, there was a bowling alley, I think, in Lincoln that was maybe refusing to enforce masks. And so there's provisions in most of the ordinances that I looked at. I just pulled up the Hastings one here. Let me see if I can. Where essentially a business that is violating that, not enforcing the ordinance, could be determined to be a public nuisance. So there's some civil penalties there as well that again could be pursued against businesses. I think Chief would probably agree with me that that would be a last resort. But if we have a business that's blatantly ignoring the mandate, that certainly would be an option. But those would be spelled out in the ordinance that would be adopted.
Thank you.
And like Ms. Nelson says, these are pretty much copies from Hastings and Kearney. Why reinvent the wheel? It's working for them. And I think that's, I'd recommend that we.
So I'd move that we would encourage the council to support and go for a temporary mask ordinance.
Dr. Erzman moves for a temporary mask ordinance, and I would like to see temporary put in there. And I think that's in here. Do we have a second?
I'll second.
Dorothy Anderson seconds.
Chief Demuth,
Yes?
Ben Johnson,
Yes.
Doug Young,
Yes.
Dorothy Anderson,
Yes.
Scott Erzman.
Yes.
Okay, thank you. The Health Board has recommended that we move this on to the City Council, which will be on Monday, 6 o'clock, public hearing. We still encourage mask and social distancing, encourage the input. There'll be no other city business taken on at that time. It will just be on the mask mandate. So, thank everybody for coming, for your input. This meeting is adjourned. Thank you. Well done, well said.
Shark lines over there. Keep their finger on the pulse of the